In conversation with Dr. Joshua M. Sharfstein, Director of Bloomberg American Health Initiative.
Well, welcome back, everyone. I hope after that discussion of food policy, you all had a good snack. Thank you so much, Congressman Fitzpatrick, for being here. You have taken a very interesting path to Congress. You not only served as an FBI special agent and federal prosecutor, but you also are an EMT. You're a Republican, but you co-chair the bipartisan caucus around mental health and substance use disorder. One of our themes today is how we find common ground on issues that divide us.
Yep.
Talk to me.
Okay, where do I begin? How do we find common ground? Well, to start on health, I think the big challenge that we have, particularly with mental health, which is the most underdiagnosed, underrecognized, undertreated, underfunded health crisis we have in this country, that we have to start with the stigma that exists, and it's a very real thing when we address, and we see it all the time in Congress, when we see healthcare addressed, more often than not, it's focused on the neck down and it's stigmatized from the neck up. And I think the key to that is parity. So we have legislation starting in the grade schools, in the elementary school level. It's called the Mental Health Excellence in Schools Act, which basically says if you have an RN in a school, you also need to have a school psychologist, and just creating parity across the board. Kids in particular have a very, very tough time dealing with a lot of the challenges they face in school with bullying and the social media, shaming and things like that, and it's really, really important that I think we destigmatize mental health and then also make it much more of a normal thing for kids to seek out, because so many of our problems can be nipped in the bud if we address it at the elementary school level.
Great, and sounds like that message you feel resonates
Very
people,
much so.
even if they're coming from different kinds of backgrounds.
Mm-hmm.
Let me ask you this. There are enormous divides in health across race and ethnicity, between rural and urban areas, and others. How do you see the role of the federal government in making America more fair and just?
Parity. I had a very profound experience. My first cycle in Congress was 115th. I represent just north of Philadelphia. Dwight Evans, my friend and colleague, represents the city of Philadelphia, and there's an amazing eye institute. It's called Wills Eye Hospital, and they had one day a year, where they shut down the center, and it's called the Give Kids Sight program, where they brought in, free of charge, any kid with their parents or guardians that wanted to come in and get eyesight examinations. And I think 35% of the kids that left there left with corrective lenses, which is really remarkable, because when you think about it, if you can't see, you can't read. If you can't read, you can't learn. If you can't learn, you can't graduate. And it makes it's a ripple effect. And this one, getting at this one root cause issue on one day out of the year for all these kids, just giving them the ability to see and therefore learn, was so important.
It is really important. In fact, Johns Hopkins has a major partnership with the Baltimore City schools to make sure that all the kids have access to glasses. And it was interesting because it rolled out in a way that you could study which the schools that got it first versus the schools that didn't. And that intervention alone was almost as impactful on educational success as tutors.
100%.
It was just hugely impactful, which gets to the question of data. One of the things that makes us a little anxious in the field of public health is that people sometimes seem to be showing up with their own data, and not just that they're showing up with their own data, but that data can seem to be coming from, planet Neptune sometimes. How do you think of this challenge of getting people together to talk about the problem and see it the same way? Even if they have different views on what to do, at least see the problem the same way. How do you think about that?
I mean, it's where do you begin? I mean, you can't start a conversation when you can't agree the sky's blue, right? There are certain fundamentals that we have to agree on to even sit down at the table together. How we've gotten to a point where data and science is questioned is beyond me. I think technology and social media have a large role to play in that. way back before any of these technologies existed, if you had some oddball view, you were sort of on your own. Now you can go online and find an entire community of people that share that belief and cause you to act out. That's some of the challenges we've seen. But we just got to get back to the basics. I think that's the bottom line. Belief in science, belief in data is the only way we're going to solve not just the public health crisis, but world peace, literally.
Yeah.
Because a lot of it comes down to data.
I understand that you've been supportive of more resources for key data collection on different kinds of issues. I think we all appreciate that. I think without data, it's really hard to know what's working, and public health is firmly rooted in that. So as someone who is trying the word bipartisan doesn't appear in many places, but you are also part of the bipartisan problem solvers.
Co-chair.
Yeah. And we want problems to be solved. That's pretty much the essence of public health. We have problems, we want them to be solved. What advice do you have for 500 people working around the country trying to solve problems, trying to figure out how to make sense of this moment?
So our group, as many of you know, there's a continuum of caucuses in Congress. So on the far right, you have the Freedom Caucus. On the far left, you have what's become known as the Squad. And then there's a number of caucuses in between. There's only one, unfortunately, but it's our group that's bipartisan. It's the Problem Solvers Caucus. In fact, it's a Noah's Ark rule. If you want to join, you have to find someone from the opposite party to join with you. Every bill we advance is a two-party solution. We sit together in the center of the chamber during the State of the Union address. We go to each other's districts. We call them district swaps. And basically, the message we advance is that we ought to take the same approach to government that we take towards our personal relationships, that you don't allow the perfect to be the enemy of the good. You take 80% of something rather than 100% of nothing. You try to see the world through the other person's eyes, because every single one of us, based on our upbringing, where we went to school, the family situation we grew up in, pain we may have experienced in our lives that other people haven't, it all affects the paradigm and how we approach problems. We follow the same model, by the way, in the FBI. Anytime we had a time-sensitive crime problem, we always use a kidnapping example because it's the most time-sensitive. Every second that ticks off that clock is another opportunity for the kidnapper to cross state lines, at which point the probability of successful outcome drops exponentially. We would surround the table with people from completely different backgrounds, and we actively sought people identifying our blind spots, because we all have blind spots. It's a part of human nature. And secure individuals actively seek people to identify their blind spots for them. So the problem solvers is essentially the legislative version of that. We don't get a whole lot of attention because we don't fight and argue with each other. Unfortunately, that is what gets the attention. We're people that respect each other as human beings. We're friends. We get to know each other's families. Right. And we actively want to learn from their perspectives because of their different life experiences.
You have our attention. Thank you so much for doing that and for that work and for joining us today at the Bloomberg American Health Summit.
Thank you. Thank you.